Hi, and welcome back to the Awaken Your Wise Woman podcast. I'm your host, Biz Cush, and got a great guest today. We're talking about menopause and vaginas and all that good stuff. But before we jump in, I just want to remind you that the Circle of Secret Sensitivity for Highly Sensitive Women is an open membership, and you can join anytime. You just need to reach out to me and I can send you the links. And it's a great community. We have lovely women who are a part of it, who meet up monthly with me live via Zoom, as well as there are all sorts of resources that are available through the membership as well. So if you want to know more about that, head to my website, elizabethcush.com, and click on the Circle of Sacred Sensitivity to find out more. Well, my guest this week is Dr. Betsy Greenleaf. And as I said, we are going to be talking about menopause and basically the importance of our pelvic health and our gynecological health. So it's a very interesting conversation. She's full of lots of expertise and knowledge. So let's jump in and talk to Dr. Betsy Greenleaf. Hi, Betsy, and welcome to the Awaken Your Wise Woman podcast.
Thank you so much, Biz, for having me. I'm so excited to be talking with you today.
I'm excited to talk to you too. I feel like I don't know if it's every season of the podcast, but I feel like it's been important to bring on guests who really validate the experience for women who are menopausal, perimenopausal, postmenopausal. Like, just it's just that it's a thing that we don't doesn't get talked about a lot. Although I do feel like it's more there is more focus happening now. But without further ado, if you could just introduce yourself and share a little bit about you and the work that you do.
Sure, I am officially the first board certified female urogynecologist in the United States, and I'm double boarded in obstetrics and gynecology, urogynecology, and the third in aesthetics. And I'm actually currently working on my fourth board certification right now in integrative medicine under Dr. Andrew Weil. So I practiced for 17 years doing pelvic reconstructive surgery. And then I've been saying that I'm retired because it sounds nice, but the truth of the matter is I'm medically retired after a car accident. I don't have, and a neck injury, I don't have the hand strength to do surgery anymore, but the truth is, I kind of think I manifested that because I was
Mm.
working for a hospital at the time that was incredibly abusive to their doctors, and lo and behold, I was like 1 month into this contract, and I knew that it was not a place I wanted to be.
Mm.
And I literally I would be so exhausted. Like I would say things in my head like, man, I wish I could just have a car accident, like just enough so that I could get some rest, but not to be like incredibly injured. And I wasn't serious about that, but one
Of
day I was
course.
driving to work and somebody couldn't get to Walmart fast enough and pulled across 3 lanes of traffic into the back of my car. And I ended up I ended up having a little car accident and herniated some discs. And interesting enough, that was the only clause in my contract that could get me off of working for that hospital was there was a disability clause. So
Wow. Oh
it
my
was
gosh.
the one and only time I got fired, and the one and only time I was very happy to no longer be at that job.
Oh my
So,
gosh.
and I honestly believe that it was the universe kind of coming in because I don't think I would have stopped on my own. And like you said, you put it out there, and all of a sudden, the universe goes, "Okay, great, we'll take care of that for you."
Right?
And then
Right?
fast
This
forward,
isn't working. Yeah,
yeah,
right.
fast forward, I was at that time, then I was teaching and speaking and traveling all the time, and I was speaking a lot on menopause, and somebody asked me a menopause question at one of the conferences. I don't know what happened. I don't know why I said this, but I blurted out that I was opening a menopause clinic. And like after it came out of my mouth, I went, "Oh, why did I say that?" And then I was like, okay, that's terrifying because I wasn't planning on going back into clinical medicine. But at the same time, I'm like, you know what? It makes perfect sense because I
Mm.
was getting really frustrated. And to your point, I agree that like menopause has not been spoken about enough in the past. Like right now it's trending for whatever reason.
Yeah.
But what was starting to happen, I was seeing people on social media who were not qualified to be talking about it or giving advice, and I was getting really
Wow.
frustrated. So I think it was like this combination of something spoke through me and combined with frustration that I blurted this out because I knew that I could do it better than what I was seeing
Wow.
being done. So fast
Amazing.
forward, that's what I just did. I opened a menopause and actually andropause. So the men don't have it easy. Like they actually have their own change that they go through. So, and I was finding as
Interesting.
I was working with women,
Hmm.
they would be like, "Hey, can you work with my husband or my boyfriend?" Or like they're having problems too. And so we were like, "Sure, let's add that into the mix." So, yeah.
Boy, boy, boy. Well, it's amazing how much our bodies go through as we enter this phase and how much is changing, but also how it impacts us emotionally.
Yeah.
Yeah. Yeah. And
One other
so,
thing is I'm finding is actually a messaging issue because I find some of my older patients that like maybe are like 70s or 80s, and I say like I have a menopause clinic. Their first response is, "Oh, honey, I've been through that a long time ago." And so
mm,
this is I don't know where that message is coming from, and I'm trying to figure that out and trying to get the message out better that this is a phase that you go through that's like from the time you stop getting your periods the rest of your life is that menopausal phase or postmenopausal, or like I guess our language doesn't fit what it is,
right.
but you have the same health concerns. You might not be suffering through that perimenopause with the crazy ups and downs of the hormones, but you still have the same health concerns as the like that early menopause for the rest of your life. So it's still this
Mm,
continuum. I kind of like to explain it to people like a butterfly in that like your reproductive years are kind of like that caterpillar phase and
hmm.
then perimenopause is the cocoon. And if you've ever seen or read about what happens to butterflies in a cocoon, is fascinatingly enough, they completely dissolve, which is crazy
Right.
that this happens in nature. They completely dissolve and cellularly reorganize. And for those women that are going through that perimenopausal period, they probably feel like they're completely dissolving. That's a
Some of
very
the time, that's for
tumultuous
sure.
time,
Yeah.
for some people. And then,
Yeah.
on the other side, you're a butterfly and you're a butterfly the rest of your life. Like this is that new
Mm.
phase. So, yeah.
That's a lovely way to look at it. I know a lot of people, well, don't necessarily see it as beautifully as that, right? As this recreation of who we are. But I do think that there is this assumption of like, okay, perimenopause is like the hard stuff. Then you hit menopause, and then it's just like, okay, I'm done. Like I just kind of move on from there. But I also want to address like there are people that I know when I guess when I was first starting perimenopausal symptoms, and at that time, I think there was still this feeling that like hormones were bad. We should not
Yeah.
be doing anything other than, suffering through the symptoms that potentially are out there, right? And that has all changed, right? That dialogue
Yes.
around, yeah, how we can get help and relief from some of the more difficult symptoms.
Yeah, I unfortunately went through training, was just finishing my training when that all happened. It was literally like one day we were like, hormones for everyone. And then the next day we're
Mm,
like, no, hormones cause cancer and heart disease and they're terrible. And that
right.
was back early 2000, so 2001 time when the Women's Health Initiative study came out. And what happened, unfortunately, with that study is it got reported in the New York Times and like it
Mm,
got blown up. So I just imagine like what would happen today if the same thing happened, but not in the newspaper. It happened over social media. Like it would have made people crazy. I mean,
mm,
it did. Unfortunately, like literally as doctors, our thing is do no harm. So we were pulling people off of their hormones left and right. So there was a lot of hot flashing, pissed off women that were miserable at this time. And,
right.
people were getting to the point where they're like, I don't care if it causes heart disease and cancer. Like, give me my hormones back.
Yeah.
Um, and then at the same time, there's a whole generation of women that missed out on hormones because they were going, oh my God, hormones are bad. I'm going to get cancer.
Right.
Now they're looking back at that study. There's so many factors. We realized it really got blown up in the media more so than it needed to be. And
Hmm.
more of the issue is the type of hormones that were used in that study. And
Mm.
they're what I like to refer to as non-natural hormones. So
Ah.
they're not the hormones that naturally occur in our bodies. And the explanation of, well, why do these hormones even exist? It's purely for business purposes because you can't patent anything that's naturally occurring. So, how does a
Mm.
pharmaceutical company make something that works in the body like a hormone that they can patent and protect their intellectual property and make money off of it? Is
Wow.
they take something that's naturally occurring and they tweak that molecule. They add a couple more carbon and oxygen bonds on there, and now it's this new novel compound that happened to work in the body, somewhat like hormones. However, what we realize now, it was even in that study, it was the type of progesterone that
Mm.
was used was more of the issue than the non-natural estrogen. And in fact, in the estrogen only arm of that study, even though they were using non-natural estrogens, those patients did not have the heart disease risk. They did not have the breast cancer
Mm.
risk. And in fact, they had improvement in osteoporosis and in lower rates of colon cancer.
Hmm.
So it was specifically the estrogen progesterone arm that they found out, and we now know that type of progesterone is incredibly inflammatory. It happens
Mm.
to be processed in the body down a pathway that makes toxic metabolites.
Mm.
And those toxic metabolites can, I'm not saying it does, but can damage DNA. And when DNA is damaged, it can cause cancer. It doesn't mean it will, but it
Right.
can.
Right.
So
Right.
there, and unfortunately, those hormones are still on the market today. And I personally think it's criminal that those are still
Oh,
being sold on the market, even though we know, the issues. So
that's
I'm a big
horrifying.
proponent of the bio, well, we refer to as bioidentical. I think the word
Mm.
bioidentical has been a little overused. I kind of like call bioequivalent or natural
Mm.
hormones. It's what our body recognizes as natural.
Okay.
Um, because we're finding out in research that those hormones are actually protective. And there was a big study that was done in France, and this is completely, has flipped my training too. For many years as a traditional doctor was like, oh, hormones are bad, and I was scared to put people on hormones. I was scared to take hormones. And now we're finding actually there was a study and it was like I think it was about 50-ish thousand women in France where they took women with breast cancer and ones without and they put them on hormones and they followed them over time and they found even the women with a history of breast cancer didn't have any adverse
Wow.
outcomes
That's
compared to
crazy.
the other group. So now they're actually starting to see it may be protective in certain
Wow.
cases. But that's
It's
something, make sure
amazing.
you're I'm not saying, blanket statement is safe for everybody. Make sure in your specific instance, you go over your doctor, with your doctor. But we're finding new
Sure.
things, and we're like, wow, you know what? This might
Yeah.
be, this is a valid treatment option for
Yeah.
people.
Yeah.
So,
I know.
yeah,
I have friends who have had incredibly extreme hot flashes to the point where, I don't know, it made life almost unbearable. And I know hormones really, really help them. They're a little bit younger than me, but yeah.
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 And it's interesting because I also, you see these trends on social media now. And the one thing that I'm finding is you get people on both ends of the spectrum who are very militant about their opinions, and you can be very militant about your opinions on social media and kind of get away with it. You have the
Sure.
people that are like, everybody needs to be on hormones. And then you
Mm.
have the people that are like, no, I'm going to be all natural. I'm just going to go through my life and do things natural. What I say is, guess what? There are so many options. I think it's personal choice.
Yeah.
There's no right or wrong. It's what you feel comfortable with and in conversations with a doctor who is trained in how to
Yeah.
manage these hormones. So,
Absolutely. Yeah.
yeah.
I feel like that's very good advice for all medicine, right? Like you have to
Yes.
find what works for you and working with your doctor to make sure they're listening to you and yeah, and
Yes.
and helping you through that. Um, and as you know, like my podcast really is focusing on highly sensitive women, and I'm curious, like, and I'm wondering if
Hmm.
for highly sensitive women there is a because our sensory experience is a little more intensified, that if potentially menopause could be, or perimenopause could be more difficult for women who are highly sensitive. And I don't know if that's something you can answer or what anything you've seen in your work.
I will say from a medical standpoint, I can't answer it, but from a personal standpoint, I can.
Mm, mm.
Having myself being an empath and also really, having a lot of friends who are into energy medicine and really kind of finding my own woo-woo aspect of life over the years and kind of admitting that I have some of these sensitivities and what I've
Mm.
seen over the years, I do believe that the women who tend to be highly sensitive tend to also feel things a lot more than, let's say, somebody who is not.
Yeah.
And so I've seen this not just with hormone changes, but also with like aches and pains in the body. And
Yes.
so I think that when you are highly sensitive, you're also more in tune to what's going on in the body and are able to pick that up. At the same time, I
Hmm.
think the energies around us also influence that. And I think if someone's already going through menopause, and they have some, and they're in the presence of somebody who may not have the best energy, I think that energy will rub off on them and will can potentially make their menopausal symptoms worse. So
Yeah.
I think if you're a highly sensitive person, I think you got to look at a number of things, like what is going on with you internally, and then
Hmm.
also what is going on in and around your environment, and which things can you change.
Yeah.
So, yeah,
Yeah. Yeah.
yeah,
That makes so
definitely.
much sense. Yeah. Because well, and I think energetically, we're all picking up on energies from other people, but I think highly sensitive people tend to be more attuned to other people's energies on the whole. And that makes so much sense to me.
Yeah.
And so, what was it that pushed you to really focus on this area for women, just sort of pelvic health and yeah, all that. Yeah.
It's definitely one of those things where, I think Steve Jobs said you can't connect the dots looking forward. You can only connect them looking backwards.
Yep,
And
makes
so,
sense.
everyone, a lot of times I get asked, like, what made you become a gynecologist who wants to look at vaginas all day long? And that's definitely
Mm.
was not my career goal as a young child, let
Right.
alone medicine. I mean, I grew up and I just happened to have an interest in medicine. But connecting the dots looking back, it all makes sense. Even from like a
Mm.
young age, at the age of 4, I remember there was like 4 or 5, there was a TV show um, that was on the TV back then. This was probably like mid 70s, called Emergency. And it was about an ambulance team out of California. And I remember
Mm.
loving that show as a kid. Like looking back, you kind of like I was like, "Oh God, I can't believe my mom actually let me watch that as a
That's
child."
so
Like, it probably
funny.
wasn't that appropriate, but I
Right.
remember really being interested in that. Same thing when my mom was pregnant with my sister. I was about 5, 5 and a half. I remember like being obsessed with the books. She had these books that like had
Mm.
pictures of the baby inside the uterus and what the uterus, and I remember like looking at that book and like being like really interested in it. Still,
Interesting.
when I said it all makes sense looking back.
Sure.
And then even
Sure.
when I went to college, I knew I was interested in medicine. I didn't know which way I wanted to go. In fact, actually, I studied biology, but I thought I wanted to go into veterinary medicine. And being a New Jersey resident, there's no veterinary school. So I applied
Mm.
to veterinary school, and medical school was my backup plan, and did not get into veterinary school because they usually take people from their own state first. So I
Interesting.
was told
Yeah.
I was told, well, move to another state, set up a residency, and then reapply. But in the
Mm.
meantime, I got into medical school, and then I really just loved it. Um, I thought I wanted to do pediatrics because that's kind of close to veterinary medicine. Meaning that the babies can't tell you what's going on.
Sure.
So,
Sure.
and I actually I found myself very frustrated with dealing with parents,
Mm,
especially in some of the inner cities where they were being given free formula and they were watering down the formula
mm,
because for whatever reason they didn't want to go pick it up from the WIC program that we have in New Jersey for free. And I was like, like how, like you're getting this for free. Like, why wouldn't you take care of your child?
yeah.
I mean, there's a lot of social issues there, but like I found myself very frustrated. And then I kind of just was drawn to some of the surgical subspecialties and found my way into gynecology. Um,
Yeah.
and really liked dealing with women. I was I actually started out in general surgery, and
Okay.
halfway through general surgery, I kind of realized it wasn't for me because general surgeons are amazing. You want them when your appendix has ruptured, but I find them to be very like much like body mechanics, like let's get in there and fix it and get out. There wasn't
Right.
this warm, fuzzy relationship. And
Relationship
so
building,
so
right?
I would go around. This was actually really funny. I would go around on my rounds in the hospital, and I really wanted to know about people's feelings. And I'd be like, "So, how do you feel now that your gallbladder is out? Like, how do you feel now that your appendix?" And it just wasn't that warm, fuzzy
It
type
wasn't the
of
same. Right,
yeah,
right, right.
but I could
Needed.
get that in the relationships in the women's health. So I
Mm,
switched into gynecology
mm.
and then urogynecology. I didn't even know that was a field until my
Well,
senior year.
I was gonna say you have to share what that is because I'm not really
Yeah.
sure.
And in
Yeah.
fact, there's only 1,500 urogynecologists in the United States. And I remember when I told my mom that I was going to do the fellowship in that, and she was like, "What is urogynecology? Is it like European gynecology, like fancy gynecology,
The extra special,
like Euro
right?
Disney?" And it's really a combination of urology and
Yeah.
gynecology. So it has to deal with the bladder. And in fact, actually, it's really everything in the pelvis, but more like bladder, bowel, reproductive organs, the muscles, the nerves.
Hmm.
Traditionally, most urogynecologists end up dealing with things like prolapse, where the organs can droop and drop
Yeah.
from ligament damage from childbirth or lifting heavy objects. They deal with incontinence issues, recurrent urinary tract infections, pelvic pain.
Yeah.
So that's kind of, we're like a super subspecialty.
Yeah.
So.
Yeah. Yeah. But it feels as if, well, I appreciate that more. There has been more attention to um, that whole subspecialty, right?
Mhm.
That pelvic health is really important to our overall health, but also to our sexual health. Like if we're, I don't know, if we're in pain when we're having sex, or if we're incontinent and so sex feels icky because we know, or prolapse even, right? Like, I don't know. It feels important that we're addressing these things with compassion and care and actually talking about them as because we know so many women suffer from these things.
Yeah, it's crazy. Like I remember, in my office, I would have women come in and talk to me about the incontinence or the prolapse, and they'd be like, "Am I the only person that you've ever seen that has this?" And I'm like, "Nope, pretty much this is what I do all day long." And I mean, from a prolapse standpoint, 50% of women will have a prolapse at some point in their lives.
That's
And
wild.
that is definitely, forget about menopause not being talked about. Pelvic health is even more like
Yeah.
um, you know, kind of quieted and hush hushed and
Yeah.
it is really I would love to like my goal in life would be number one to let's talk about, be able to get to the point where you could talk about these things and people don't blush or get embarrassed. And there was a study actually it was actually done in Europe, but I'm sure it applies here that 61% of women are uncomfortable saying the word vagina.
Hmm.
But the fact is, 83% of us will have a problem down
With our
there at some
vagina.
point in our lives. So if we can't say the words, how do we
Oh
ask for
gosh.
help? So yeah, yeah,
That's wild. Wild,
yeah, it's
wild,
really, and
wild.
unfortunately, like I think I say the word vagina so much, like I'm desensitized to it. So like sometimes I have to watch when the company I'm with just like start talking about
Just
vaginas, and my poor teenage girls like are just like, "Mom," and I'm like, "Oh yeah." But
right.
but
Oops.
really, I mean, it's
Yeah,
no big
yeah.
deal. It's just another body part. I'm
No,
all
it's
the
true.
I'm always in trouble on Facebook because I'll put something about vaginas and then they'll tell me this word goes against community standards. I'm like, what do you want me to call it? Like,
Right?
really?
Right? Right. Make up some, yeah, ridiculous,
Yeah. So I
yeah.
have to spell it now. When I remember, I have to spell it like V at symbol, like G exclamation point N A, like, and I'm like, really? This is
Oh,
ridiculous.
oh my gosh, that is insane. Well,
Yeah.
and I think about too how many women I know who suffer from incontinence and how it feels as if it's pretty common.
It's very, very common. Yeah.
And I
And the
feel
thing
like,
is, there's tons of different options.
well, I was going to say,
So,
I feel like there are things you can do, and most people, at least the people I have known, they just like, oh, you just have to deal with it. We just have to suffer through and, manage it however we manage it. But also, there's sort of a shame aspect too. Like, I should be able to control this, even though it's not within your control because it's your body that's doing this. Yeah.
yeah, I know it's really a shame because I think a lot of people just go, "Oh, this is just get a natural part of getting older," and they just
Right, right,
accept it.
right.
I mean, the adult diaper and pad industry is a multi-billion dollar industry. And I've
Crazy.
had women who don't leave their homes because they are embarrassed and didn't realize that they could do anything about it. And there's so many different treatments. I mean, anything from like physical therapy, supplements, medications to the extreme doing surgery. But there's so
Right.
many things in between that.
Yeah.
So, there is definite like I mean, I'm a big proponent of people seeing urogynecologists because I am one, but like I said, there's only 1,500 of us in the United States. So
Yeah. Yeah.
urologist would be the next option, but like specifically finding one that does women's health because sometimes the urologists focus just mainly on men's health and they kind of miss the boat when it comes to some of
Yeah.
the things with women's health. So, yeah.
Yeah. Yeah. Oh, I hear that 100%. Um, so for you, like if there were women out there that are listening who were struggling with some of the stuff we've talked about today, what would you offer to them? What would you like them to know?
I think the biggest thing is there's a misconception that hormones are the answer, and hormones are just a tool in our toolbox.
Mm,
And really, and the one thing that's driving me a little bit crazy right now is the number of these online companies that are popping up where you don't even see a practitioner. You're basically just putting in your information, and next thing you know, you're getting a prescription for hormones. Here's the thing, hormones don't work unless the body's prepared for it. And that means
mm,
I always say sex and stress can't coexist. So, sex meaning sex hormones, fertility, and even libido. That has to all happen and work well in a relaxed state. If there's any stressors happening, the body
mm,
will convert those hormones into cortisol, which is a stress hormone. So even if you're taking hormones, if your body's stressed, and that can be mental stress or physical stress, and I'll go through what the stressors can be, like you can back convert it into cortisol. So that's why the hormones don't work. So the hormones are a tool, but they work better when we are in a relaxed state.
wow.
So what are the stressors? The
Hmm.
stressors can be anything from not getting enough sleep, not drinking enough water, eating inflammatory foods. So anything that's processed, sugars. I tell my patients that your food should fall into four categories. That your food should have at some point walked, swam, flew, or grew. Because Doritos don't grow on trees. There's no free range Twinkies.
True that.
Like, so it
True
fits into
that.
those four categories, and those are considered whole foods and they're healthy. Mental stress, physical stress, like of a disease and illness. When the pandemic happened, we saw people's hormones go crazy because of
Oh,
a
God.
combination the virus and or the stressor of the vaccine.
Yeah.
And mental stress comes in so many different, it could be like work stress, relationship stress, financial stress. So all, once again, doing the basics and looking at how can we decrease our level of stress so that if we choose to do hormones, then it works better.
Yeah.
One of the things I like to incorporate into my programming is I actually test everybody their gut microbiome, and that's what a
Mm,
passion of mine is, the microbiome, which is the organisms that live on and in our body, and they're finding that they really have a tremendous impact on our health, our wellness, or even our mental health. Because if our gut bacteria is off, 90% of our happy hormone is made in our gut. So if our
mm,
gut is off, we're more prone to depression, anxiety, mental
makes
health
sense.
issues.
Yeah.
Um, 80% of our immune system is made in our gut. So if our gut is off, we're more likely to get ill. I found that over the years just doing this for people, that same thing when I just gave them hormones and they didn't work, because that's how I was originally trained, like, all right, just give them hormones, and I'd be like, well, why? But if I know
Mm,
that their gut is balanced, and most people do have some gut imbalances, if I can balance their gut and decrease that while working on lifestyle things, and then we add the hormones into everything, everything works so much better.
that
So
makes so much sense, though, right? I mean, like our bodies are, they know what to do, but if we are under distress or under stress all the time, they're going to react to that too. Yeah.
yeah,
Yeah.
yeah.
Yeah. Wow.
And actually, the
Mm,
thing I forgot to mention is, which is really kind of scary, is the number of chemicals that we're exposed to on a daily basis. And some of these chemicals can actually disrupt our hormones. So there is a wonderful
oh, yeah.
website that I recommend people take a look at. It's called the Environmental Working Group, or EWG.org. And you can go look up your beauty products and see if you're using things that are healthy, because things that we're putting on our bodies sometimes can be affecting our hormones too.
That makes
So
sense too. I mean,
yeah.
you think about just the impact of, I was just reading an article about plastics and how
Yes.
on every level they're entering our bloodstream and our whole bodies. So, it's a little terrifying because there's
It,
so
it
much
the
plastic out
environment,
there.
yeah, the environmental toxin is that you go down that rabbit hole. It's very frustrating because there's really at our level of modern life, there's we can only actively
Do so
try to
much.
reduce our exposure. We're not going to get rid of it. It's
Yeah.
around us.
Yeah.
It's in our food sources. I mean, this is a better idea why eating organic, if you can afford to eat organic, is better because of the insecticides and pesticides and how they can disrupt our hormones. There's
Yeah.
only so much we can do. Also, on the environmental working group, they have a list. It's called the Dirty Dozen. So it's
Mm.
the 12 foods that tend to be the highest in toxins. And so
Oh,
even if you
interesting.
can just cut those foods out and replace them with organic options, you're better off.
Hmm.
Yeah.
I'll have to check it
Yeah.
out. I'll have to check it out. Well, if listeners wanted to find out more about you, Betsy, how would they do that?
Yeah, so I am on every platform and social media. If you just look up Dr. Betsy Greenleaf, Betsy, and then Green and Leaf, you'll find me someplace. So please follow. And, I love interacting with people. So on there. Also, my practice is called the International Pause Institute. And you can find it at pause, like Pause, like menopause, but without
Yeah.
the pauseinstitute.com. On that website, there's a free hormone quiz, which kind of gives you,
Nice.
just by answering a couple questions, gives you an idea of where you may be. And then also, I have a website called the Pelvic Floor Store, which I started in 2018 because I had a patient who wanted a centralized place to buy all the products that I was recommending instead of going to this website, that website. So it was brilliant.
Nice.
So I started the Pelvic Floor Store. And actually, if you use the code Awaken, all uppercase, you can get 10% off. And I sent you that link.
Yeah,
So,
you did. I will include that in the show notes. I appreciate
yeah.
that so much. Thank you.
Oh, and last thing, I didn't even tell, I always forget to tell people this. So this past year, I created a menopause rock album that you can find on you can find on Apple and Spotify. It started off as a joke between me and my friends. We're like, there's not enough songs out there celebrating like midlife women. Like there should be more songs because there's more of us. And so it started as a joke, and next thing you know, we ended up kind of writing it and found people to sing it, and we produced the album, and we're like, it just became
That's so
like a
cool.
fun thing to do, and then we put it out, and it's called Menopause Memo.
Nice.
And you can find it on yeah, like I said, you can find it on like all the platforms. Oh, and one last thing. I am
Yeah.
restarting up my podcast. I had one in the past, but I'm
Mm,
starting one in very soon called 40s Forward. And you can find that wherever
nice.
you listen to podcasts. So
Awesome. 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 Well, I will include all those, yeah, all that information in the show notes, and I hope people will check it out. Thanks so much for coming on the podcast. I really appreciate it. This was a great conversation.
thank you so much, Biz. I really appreciate the opportunity.
Well, that was fascinating. I always appreciate um, just learning more about what's happening to our bodies as we age and as we move through menopause. And I thought that Betsy's comments about how stress impacts so much of our system, whether it's our symptoms of perimenopause or menopause, or whether hormones are going to really work well for us if we're carrying a lot of stress, none of that's going to help as much as it could. And I think that's probably something that we can take to heart for all of our wellness needs. If we're carrying a ton of stress and a ton of cortisol is building up in our bodies, like it's unhealthy, but it also is destabilizing. We end up, yeah, anxious, depressed, not sleeping, all the things. So it's really important to be looking at your life holistically in terms of, what stressors are there and what you can potentially eliminate or at least minimize, because that will make you take better care of you. Well, again, if you're interested in joining me and other highly sensitive women on a monthly basis through my membership, go to my website, elizabethcush.com, and click on the Circle of Sacred Sensitivity to find out more. I'll see you back here next time on the podcast.